we go. So, okay, let's get this going. As you know, today our main topic is going to be just revisiting performance measures and really talking about what does it take to write a strong performance measurement section. I think over time, especially for those of you that have had programs around for a while, I think the expectation has changed slightly in terms of how much more should be in there. So I want to make sure I walk through that, show you some that are pretty good, and then show you like what a lot still look like, so you can look back at what you've done in the past and see if you might need to make some tweaks. But before, and so what we're going to do when we switch over to talk about performance measures, want to just like re-highlight what's the current guidance to keep in mind as you're doing your application around aligned performance measures. Give a few bars on the data collection piece. As I just mentioned, some tips for actually doing the performance measurement application. And I want to just briefly touch on a couple of things out of data quality, like not going to go and do the deep dive on what I still want to say CNCS, and I'm trying to train myself to say AmeriCorps or the agency, what they mean and what, because I think the whole data quality piece plays in as you're thinking about how, especially how you're going to collect your data, what tools you're going to use, and how you get people ready to do the data collection if your members are doing that. So that's what we're going to cover. After, I want to like hit a few bars on evidence just to underscore a few things. And I have reviewed or started to review a few of your evidence write-ups. And like I see some sort of common challenges that are not unique to New Hampshire, but pretty much to everybody. So I want to give you a few more tips. So in the materials that Emily sent out this morning, I went in and pulled out 4 evidence samples from applications that I have reviewed in the past. There's like no perfect evidence write-up. So, you know, there's ways to improve pretty much all of them. But what I tried to do was pick one for each of the tiers. And I did it as a 2-column thing so that you could see what a program said. And then like in the right-hand column, I tried to reference, okay, they did this well, but then here might have been an upgrade that they could consider. Just because, like, I know folks had asked, okay, can we see some that are pretty good to get some sense of where to shoot? So, you know, I suggest you take a look at those. But like I say, there's no perfect narratives, but I think you can get some ideas of how to structure things if you take a look at some of those. So the one thing I want to really underscore from what we talked about last time is this whole kind of setting the bar, and what you have to make the case for in the evidence section is same intervention. So if you're quoting studies about programs that are kind of in the same ballpark as you, like you really need to make like an intro statement at the beginning of the evidence section that says, you know, something about based on our core activities being whatever they are and how our members deliver that service, you know, we are presenting the following studies as evidence. And what you're really trying to show, like that you can find studies, great, but you've got to like in some ways go overboard, it may feel like, to actually say, okay, especially if it was like an AmeriCorps program, well, the population delivering the service is members. We have members. But the biggest piece is what you're trying to say is, because this program did XYZ, kind of at the same level we're doing it. Our members are doing the same thing. And because they found these positive results, which you have to kind of summarize, you know, we feel like our model is going to be able to have sort of the same, create sort of the same benefits or outcomes. And you kind of have to like almost spoon feed that and really underscore for the reader that you think this is close enough and like as close as possible, hopefully, to what your members are doing. That's why you're presenting it as evidence that what you're going to do is strong and can create some positive stuff. So it may seem like by talking about what a study showed and just mentioning that some activities are the same, that's enough. I would go the next step and really make sure you say, because this program was delivering services in the same way we are, and describe what that is, you know, and then say sort of what they were doing and what they found out. Like, I just think the more you can make it clear that it really is the same, you know, so like for an environmental program, like the beneficiary is, you know, a trail maybe. So sometimes depending on where a study's been done, trails may be a bit different. You know, I've been working on an evaluation for a trail project in Maine. And, you know, there's some studies from Hawaii or from North Carolina. Well, you know, their forests aren't the same as the ones like in Maine or in New Hampshire. So, but what the members were doing was pretty much the same. So, you know, I think saying, okay, even though in that case, like the forest and the soils may be different, the members are doing really similar activities. They're picking trails for these reasons and they're improving them in these ways, which is the same thing that this program did. And then kind of highlighting how what you expect will be the positive nature of what your members are doing is like what this other one did, like as clear as you can make that. And it's often you need some kind of a paragraph at the beginning of your evidence section that says whether you think you're evidence informed or evidence based, and kind of lay out what you're going to present as your evidence, and tie it directly to what it is your program does, and then go into the studies. And even if you feel like you've got strong studies that you're able to find that are really close, maybe they're even on your own program, put your performance measurement data in there. Maybe it's the last thing you put in. If you're not pre-preliminary, if you're pre-preliminary, that should be like the first thing. But I don't think it ever hurts to kind of toss if you got space. But you know, this is worth a lot of points, so make sure you kind of cover all your bases. So any questions on evidence before we hop off this topic? Because, you know, this one it's tough.
I have a question, so I'm not sure how articulate I can be about it necessarily, but you know, I think I mentioned, you know, in years past, I'd sort of been provided guidance from our corporation program officer for one of our national directs that, you know, the most important thing is to, you know really well what the community need is and have your program be meeting that community need. And then you use the closest performance measure that like fits, but just be like, you know, really good at what you do and be able to articulate that clearly. So my question is around kind of the evidence. So, you know, typically our evidence is really strong about showing how what we're doing is similar to the evidence that we've found that meets that important community need. And sometimes it's not, as I'm saying, it's not directly, the performance measure is a little sideways. So sometimes it feels like that it doesn't all line up right. You know, when you get to the performance measure, to be like, here, it's like, oh, well, that's not exactly here. It's just over here a little, you know? So I don't know.
So a couple of thoughts, and tell me if I'm actually zeroing in on what you're really getting at here. Is in some ways, kind of think of these things as sort of, they're two buckets, but they inform each other. So absolutely, no matter what a program does, having a really strong theory of change, which means, you know, having a good write-up about what's the specific need that you're taking on, then how your members are going to address that in like quite a bit of detail, what the interventions are, design, dosage, and then what the desired outcomes are. Like that piece needs to be really clear. And then, and we're going to talk about performance measures today, but then you have to pick performance measures that align with your theory of change. And, you know, it used to be that there was pressure to try to pick national measures. And I know we've talked about this a little bit before, but if like picking a national measure just to pick a national measure doesn't align with what you say, here's the problem, here's what we're going to do about it, and here's how we think we can change things. If the national measures don't actually align with that, don't pick one. Now, the evidence piece, what you're more looking at, like, yes, of course, the need needs to be roughly the same. Like, you're not going to do, and I'm just picking a out of the sky example, like you're not going to do third grade reading tutoring through an AmeriCorps program if there's no need for kids to have third grade reading tutoring. But the bigger thing I think you're trying to emphasize in the evidence is, given that there was this need, you know, this other program, or maybe your own if you've done your own evaluation, but I think a lot of folks are looking for other studies done by other programs. This other program took it on in this way, and we are also taking it on. Maybe it's exactly this way, which, you know, then is considered stronger evidence, but it might be that you have to say, all right, they did this, we're doing this subset of it. They had good results, so we think, you know, with our population and blah, blah, because we're doing this chunk, we're also going to see positive results. So it's less about their performance measures. It's about, you need to talk about your performance measures for each major bucket of activity that your members are doing. Steve, did I start going down the road of what you were really asking, or did I miss it?
Yeah, no, that helps. I mean, it makes it clear. It's it makes me rethink some of how it sounds like it is important based on your statement about the theory of change needs to lead directly to the performance measure. It is important that there be a straight path from the theory of change, essentially like the activities, to the impact we're going to measure. And, yeah. And if that doesn't fit with a standardized performance measure, we should consider a not standardized performance measure to make the proposal stronger.
Yeah. And, you know, that's one of the things I want to make sure to talk about in the time we have. And
yeah, sorry, is there a penalty, a point penalty in the proposal for not using the standardized performance measures?
No.
There isn't anymore. Okay.
Anything you want to say about that? I see you also shaking your head. So I think sometimes it's good for people to hear it from you or Andrea.
Oh, well, I mean, there's nothing that about like performance measures in there. I mean, you have to have them, but they don't have like points associated with them. I will say, I know in the past, if like a program has submitted their own performance measure, the corporate or AmeriCorps might come back and say, this is really close to the national performance measure, use this one instead, but they won't take points off for it. It's more of like a clarification issue.
Yeah. So I think the bigger thing driving how you pick your performance measures is how you describe your theory of change and what you've put in your logic model. Like if you've done a really clean job with your logic model, you know, the output is going to be already lined out, and most likely you're going to be measuring as your outcome the short-term outcome. Maybe for some of your programs, the way you've laid out, excuse me, your logic model, you might be measuring a medium or longer term thing, but I think for most people, what you end up doing is measuring your short-term outcome. But what you have in your performance measures, like when a reviewer is looking at your application, what you don't want them to do is be scratching their head going, okay, the logic model says this. The theory of change mostly sounds the same, but they're talking about some other stuff, maybe with different language. And then the performance measures, you know, and we're going to go over this, when you write up that section, you're doing a summary of this stuff from either your theory of change narrative and your logic model, and these two should be kind of the same, maybe with an expanded version in the theory of change. It needs to sound exactly the same in your performance measurement section. And, you know, in the end, the performance measurement section in a way becomes like the Cliff Notes version of your entire application. So like the stuff that you put in there needs to be with probably more detail than some of you may have done in the past, because it needs to be able to be looked at almost as a standalone thing, so that somebody can read, here's the problem you're taking on, here's the intervention that you're going to measure. You know, if you've got multiple buckets of activity, you don't try to cram it all into your performance measure if you're not actually going to measure all of it. You're only talking about the intervention that you're going to measure there. And then, you know, there's what you have to say about how you're going to measure, what's your output, what's your outcome, and how you're going to measure them. But we're going to talk more about that. But it absolutely needs to be seamless, kind of no matter which format it's in or which location in the application. These things all need to sound the same. So that's something to double check yourself on, especially if you're doing cut and paste from past applications because you're running out of time or whatever. You really do need to go back and make sure that these things all sound the same in every location. And for those of you that are doing evaluation plans, and we're going to talk about that in the next section, the theory of change needs to sound the same there too. So there's really 4 places you're talking about the problem, what you're doing about it, and what you hope is going to change because of your AmeriCorps member service. So let's dive in and just kind of do sort of a high level review of what are these things and how are they different? So outputs are it's the bean counting thing. It's really like the counts of how much service gets provided by members. And for most programs that are unless you're an environmental program, what you're counting is how many people got served by members. Maybe members and volunteers, depending on what your program model is. But for the most part, you're counting people, or you're counting, if it's an environmental thing, if you're using national measures, it's miles of trail or acres. You could come up with some other output if it's more relevant, but what you shouldn't do is like, okay, it's how many environmental education sessions are given. What you want to back out of that is, okay, that's fine, you can track that, but that's not your output. Your output really is how many people attended those things. So you have to be really clear, and especially if you look through the national measures, even if you're not going to use one, they've now like pared those back. So it's pretty much no matter what priority area, it's all number of individuals served. Like they don't like number of families. You got to figure out like how many people. So no matter what you're doing, you may be counting some other stuff for your internal tracking purposes, but what your performance measure should be is around the number of people, unless you're an environmental program, and then you're counting something else. So I think there's still some people that are trying to cram outcomes into the output area. So like anytime you see something like increasing and something's changing and that's in an output section, it's in the wrong place. And hopefully having like revisited logic model and really making sure you've got the right stuff in the right column there, you know, that if any of you have kind of tried to cram outcomes into the output section in the past, hopefully you've caught yourself and you've like moved it to the right section. But let's say a few a few bars about outcomes. So again, most of the time, if you're not doing something environmental, you're tracking some kind of a change with people. And if you're doing something that's in the environmental category, you know, I think it's harder to really show what an outcome is there. And so if you are doing like a trails project or an invasive species project program, then, you know, the national measures are just treated and improved. And you have to have a way to document that things are improved. But in some ways, it's harder, but it's easier. Like I think for folks that are members are actually serving people and then trying to figure out how to make sure to measure accurately the kind of change that you've talked about in your theory of change and that is laid out on the opposite side as the problem in your theory of change, you know, sometimes that can be more complicated. So I think most of the time you're going to be measuring either change in the environment or change in individuals. If you're setting yourself up as a rural intermediary, then you're going to maybe be, and you're doing sort of capacity building things, then you're going to be more likely to be having to think about outcomes for organizations, like how have members helped build capacity on scale and reach of programs, efficiency, effectiveness. Have they helped create more programs, serve more people, that kind of stuff. But I think for most of you, the changes that you are going to measure are in people. And then environmental programs, you're doing something different. So on the people side, and I know we talked about this briefly earlier, but as you're thinking about for people, what you want to see change, you know, ask yourself, well, what is it? Like, which bucket is it in? Are you trying to, in the short term, like maybe long term, you're trying to, if it's a Healthy Futures program, you're trying to help people be healthier, but that's got to start someplace. Like, you don't go there immediately. So at first, I was talking to a diabetes program in another state yesterday. And so, you know, what they have members doing is they do like diabetes education sessions, because they need people to know, understand some basics about, okay, if you've got diabetes or you're pre-diabetic, how do you know enough about your condition that you can actually do something positive for yourself? And then like eventually what it is like, is there like behavior change? And then at the end of the day, it's, are you healthier? And in their case, they actually measure, their partners measure A1C, so they can actually see if blood sugar levels go down, which I think a lot of programs can't do. But you need to kind of have been thinking about what's the kind of change you're going to measure for your performance measurement outcome, because that's going to help you think about how you're going to measure it and what it's going to take to do that, because you have to describe that in the performance measurement describe instrument section. And again, as you're looking back at what you have, if you've got anything in the output section that says, you know, they're gonna more, greater, less, fewer, decrease, increase, double check yourself, because those are often indicators that you're actually talking about a change in one of these categories. And so it isn't an output, it's an outcome. So any questions on that?
It looks like we do have a question in the chat box.
Okay.
Let's see, it says, if you have a primary intervention and a secondary intervention, we report on both of these, but AmeriCorps only scores us based on our primary intervention. So at what length and depth do we add or speak to, if at all, the secondary intervention?
Well, the requirement is one aligned set of measures, an output and an outcome. And I think most people, like if you actually have defined it for yourself as a primary intervention, which likely means more member time is spent doing that thing, whatever it is, then that should be your aligned measure. Yeah, and Emily and Andrea, maybe you can weigh in on the New Hampshire approach. I think a lot of states are starting to go in the, you know, there's not always a strategic advantage to doing more performance measures than the one. Better to do one and do a really solid job with it. Although, as we'll talk about in a bit, if you choose to, you could put in an output only measure for the secondary piece. But Emily and Andrea, what is your preference in terms of how you want to see people that do multiple things handle that?
Well, we've kind of always taken the approach of really use what is the primary to your program. You know, what is the biggest piece of your program? What are you doing? What are you measuring? With that being said, I mean, we've knowing that there are many programs that do put in a secondary intervention, so we've never said, oh, you can't do that. And I don't recall that we've ever had that many clarification issues come back from CNCS with people that put in a secondary. So I would say go with what is the, you know, fits the biggest piece of your program.
Yeah, I know CNCS is, they say you just need one, and they're like, well, if you do something that's another big part, you should probably report on it, but you're not required to. I would probably say, I mean, I think sometimes we've seen like newer programs that just have like 4 or 5 performance measures, but they're all they're not national, they're like applicant determined, and that might be like a lot to have to keep track of. So we might say, you know, maybe just 1 or 2, because the more you say you do, the more that you'd have to report on, and it gets a lot more burdensome, I would imagine, unless programs have a really good way of tracking all that data.
Yeah. And I want to underscore something that Emily just said directly, is that, you know, the more things you put in as performance measures, if you don't follow what Andrea was talking about, which is, okay, pick the major chunk to do your performance measures on. You know, it's not wrong to have more, but just realize not having them as a formal performance measure in your application doesn't mean you're not collecting that data for your own internal use and tracking. You likely need to know that stuff, but as soon as you put it in and it becomes sort of a part of your contract with New Hampshire, then, and CN AmeriCorps agency headquarters, like once it's in there as a formal performance measure, then the bar goes up a lot. And, you know, there's more and more emphasis on data quality. I'm going to touch on that really briefly towards the end, but then you have to make sure you're doing a really strong job, and it, you know, that stuff then can get monitored in a different way. So just because it's not a formal compliance performance measurement doesn't mean you're not tracking that data. And as Emily said, you could report on it someplace else in a report. You can use that for other things, but as soon as you make it a formal compliance focused thing, it's more work. So if you're really committed to having more things in there, you know, it's not wrong, but just know that you're putting yourself on notice that you've got to make sure you do a really strong job with all of it. And the good news is you might decide, all right, we're just going to collect this offline and then tell people about it. And we don't need it as a, like, think of what goes in your application as like, that's your compliance piece, you know, and New Hampshire's going to keep their eye on that. Like, and then, you know, that's what goes in the report. And did you meet your target or not? You know, it just opens up another whole ball of wax if you don't meet it. So I think simple is good. You know, I was talking to a program in another state that they have an opioid piece of what they do, and they have like a financial literacy piece. They do their performance measures on the literacy piece. They feel like the opioid counseling and support services that are that members are doing is a little tougher to get at outcomes of, but they want to be known for that piece in a way. So what they've done is put in an output only, and then they can just report how many people got services without having to go into the, how are we really going to know? And they're trying some stuff. That piece is newer for their program. They're trying some things offline to see how can we actually measure this in case we want to do that as our performance measure in the future. But, you know, it's a choice point. Like, they decided they wanted to do it. They're a program that's been around for like 24 years. That's a newer piece for them. So they thought they wanted to, but that's each individual program. Their commission is not saying you have to do that, just like yours is not saying that. So it's kind of a program by program decision, but I would say don't overcommit. You got plenty else to do. So.
And so I'd like to just add too, like, I know, for instance, one program for many years, they would consistently not be meeting their primary interventions targets, but they did have a secondary intervention and they would always meet those targets. So it was kind of like they were constantly conflicted with, well, the bigger piece of our program, we're not meeting it. You know, what we're supposed to be doing, and that secondary piece, we're always doing it. So I know we struggled with, well, how do we steer you in the right direction with, you know,
Yeah,
what you should be measuring.
right. And, you know, just like a couple bars that I think, you know, to reinforce something that you're saying is like, yes, you have to measure an output and an outcome and a line set. And that is part of your program's compliance piece, because that gets tracked and you have to report on it. And if you only think of it as a compliance thing, you're kind of missing an opportunity. Like a piece of it is, if you find out that for the major thing that your program is doing, you're never meeting your target. That's an opportunity to think, well, why not? Like, is it we didn't set our performance measure up well? Like we shot too high with our what's realistic in terms of either how many we can serve or how much change can be expected? Or is it that maybe it's an opportunity to dig. If you're not meeting it, and that happens, it's not just a fluke. Oh, it was a COVID year, or oh, there were wicked ice storms, and you know we couldn't do what we had planned. Like, is there something with your model that needs strengthening? Do your members need more training? Like, it's an opportunity. It's an opportunity to think, well, what's going on here? Like, we're working hard. We have members out there serving, doing stuff. Why isn't it working the way we think it is? And that can be a way that evidence can be useful if it's a really similar program, because then you can look at, well, how are we really doing the intervention the way other successful programs are? Is our dosage high enough? Is there something that these other programs are doing that we're not, that if we did it, it can strengthen us? So if you're not meeting your performance measures, I mean, at the top of the list, it's a continuous improvement opportunity for your program to think about, well, why didn't we make it? It's not just, oh, this site didn't turn in data, or like, yeah, that stuff may be in there, but there may be some deeper thing that if you've set it up and it never seems to work, well, why not? And how can you tweak it to make sure that you're not facing that every time, in the stress of having to have Andrea and Emily be like, okay, hello, what happened here again? You know, so that makes sense. Yep. Emily, any other questions that have come through?
Not so far.
Okay, so either feel free, because you know we're a relatively small group here, unmute and ask a question live, or feel free to put it in the chat and Emily will make sure she breaks in and we get it answered. Because you know, I don't want you to leave feeling like I'm confused about this or that. Like, please ask, because you've got Andrea, Emily, and me all on here, and we want to make sure that when you sit down to revisit your application, and with any chunk that we're talking about, that you have what you need to do a really great job and maybe take it up a notch or two from maybe where you were in the past. So we mentioned this a little bit before, but I want to just revisit it quickly, is because, and I was part of the initial team that helped think about national measures. And you know what then CNCS had in mind was, you know, there's a lot of programs doing sort of similar things across the country. And in the early days of AmeriCorps, people were measuring all kinds of things. They used slightly different wording. So when they reported through their commission up to, and it got sent up to headquarters, they had a really hard time compiling all that data to be able to make some kind of a case for Congress, like, okay, here's what we're doing with this program called AmeriCorps, and here's why you should continue to fund it because it's doing all this great stuff. So they're like, you know, there's some major buckets that a lot of programs are in. So back in the early days, a lot of programs were begging, just tell us what you want us to measure. So, you know, the CNCS held off on that for a really long time. And then they decided, all right, we're going to come up with some measures on things that are our priorities from our strategic plan. And we're going to come up with national measures. And as Steve has referred to in some of his comments, there was a lot of pressure, I don't know, 10 years ago, something like that, to use national measures. And so a lot of people picked national measures that didn't flow from their theory of change nicely, just because, yes, there was pressure and people thought they had to, and maybe at that time that was a bit more the reality. The good news is that then CNCS realized we're getting a lot of kind of garbage data being collected that doesn't really fit what some of these programs are doing, like how they've designed themselves and what they're doing and the kind of outcomes they're producing. These national measures aren't doing justice to that. So they have completely backed off trying to really push people to national measures unless it absolutely aligns with what your theory of change is. Then you are, as Emily said, you know, they want you to use a national measure if it's close enough to what you would measure anyway. Like if you put in one that you come up with yourself that sounds pretty much like one that they have, they're going to ask some questions about that and maybe make you change it. So I'd say for most programs, you can almost always use the output measure that is the national measure, like, because you're counting people served. So like if it's an education program, ED1A, number of individuals served, you know, pretty much everybody that's doing education can use that. Where they've also, like it used to be really strict. If you use this national measure output, you have to use this national measure outcome. And again, they've backed off that. If the outcome doesn't really match what your program's doing, you can use a national measure for your output and have an applicant determined measure for your outcome. If there's not one that they've kept, because they've also kind of pared these back quite a bit in different categories, you know, you can propose your own. And that's not a ding. Like what you've got to make sure though is that it is tightly aligned with your theory of change and your logic model. And you know, in the past they didn't allow these output only measures. But now you can have that. And like I know there's a Colorado program that they feel really strongly, like there's a huge chunk of their program that doesn't get counted anywhere. So they're doing an output only measure for like that chunk of their program. So that's an option. That's not a requirement, but you have to have one aligned set. So, and you just have to double check yourself that the output and the outcome are measuring the same beneficiary. So if it's an environmental program, if your output is trails, your outcome is going to be trails. If your output is about tutoring students, your outcome has to be some change in students in some way based on what members were doing. Like you can't have the output be students and then the outcome be changes in mentors. you know, I don't think many people do that anymore, but I have seen many applications where they take a right angle for the outcome. So make sure it's the same bucket of people or things that your aligned set is based on. So I think another thing, and none of you are brand new, like first time applicants. So you've got some experience with what's realistic in terms of what targets can be. And, you know, setting targets, you know, you have to be like realistic about what's possible there, like lowballing it or shooting too high because you think you're going to get more bonus points that don't exist. Because you think, okay, it sounds better. We're going to get funding if we promise to serve this many people. It's like if you say you're going to have 10 members, you're going to serve 22,000. It's like, hello, that doesn't compute. And it means that it's going to be like a drive-by service. Like you're not going to be able to see much change with those people. So like you'll get questions if you pick a target and you're way below it. Like if you don't meet it, either on the low end or you go over, they're going to ask some questions, you know, you're going to get some questions about that. But so basically all of you are either tracking how many people got served as your output or how many acres or miles treated. Might be something else besides these two things, but I'd say for 90+% of programs nationally, it's one of these two things. Then the outcome, you have to think about what's the, of like everybody that gets served, who are you going to measure outcomes on? So one of the things that I always talk with programs about is, okay, so say it's a middle school math and English tutoring program. So maybe the program, and I just worked with one in another state, like they serve like 900 kids. It's a big program. But then they only report positive changes in math or English scores on those students that members work with at least a certain amount of time. And then they report on that. So it's a subset automatically of all the people that got served, because the reality is sometimes, using that example, partway through a school year, somebody moves or they drop off the face of the planet and they stop coming to class or to their tutoring sessions. So if you try, and the reality is you probably can't get data on some of them anyway, if they've like kind of fallen out of being served for whatever reason. But you also want to make sure that you're measuring the outcome of the people that got closer to what you consider sort of the ideal or minimum amount of service that it takes to actually create a change. So if you're comparing, again, I'm just making some kind of crazy examples here to make my point, but students that got 5 hours of reading tutoring with students that got 20 or 25 hours of reading tutoring, if you're measuring outcomes and lumping them all into one bucket, it's going to look like your program isn't that effective. So really doing a great job on the people that get at least, say, 15 hours of one-on-one tutoring or whatever it is, then that puts all those people sort of in a similar bucket. And then you can see, okay, how are we moving the needle with those people? So you need to describe this, and we'll talk about this in a second, in the describe instruments section. You have to say, okay, who, like, if you're doing a subset of individuals for the outcome, how you're going to pick them. Like, are they people that got served for the whole year? Are they people that successfully completed a 4-series workshop? Like you don't want to try to compare people that showed up once with people that showed up 4 times. If 4 times is 4 times out of maybe 5 is what it takes to actually see some real change. So when you're setting your target, you know, I think a lot of times over time, folks think, okay, if we serve 100, then we're going to assume that 75% of or something of those people that will be what our target is for an outcome. And maybe that still works, but you kind of need to think the next layer down about that. So any questions on what I'm getting at there? And Andrea or Emily, please feel free to jump in at any time if you've got something that you want to add.
Well, there are no questions in the chat box right now.
Okay, well, we will keep going then. All right, so once you think about what your outcome is, especially for outcome and output, you have to have a data collection tool or process. But I think for a lot of programs, it's easier to be able to track people served or count people, or I think with environmental programs, sometimes that's a little harder. Like, are you going to use GPS to track how many miles? Like, you know, like, but I think most programs, how you actually track the output is, and talk about that is not where the issue is. I think sometimes where it's harder is figuring out what's the best data collection tool to get at an outcome, which is why, you know, I emphasized earlier that you have to be really clear, like what your outcome is, because the kind of tool you pick has to align with that. So if somebody was an education program and they said they were going to do ED 27, I think it's C now, and what the program does is social emotional learning, but then what they selected as their data collection tool was standardized test scores in English, you know, that way of measuring is not gonna get at what they said they were trying to measure. So you have to really make sure that the tools you're proposing in your grant application, and we're gonna talk about this in a minute, like have to be able to get at the kind of outcome you're saying you're gonna measure. And you also have to think about what's the timing that matches sort of the flow of how service gets delivered. So if there's a chunk of your program that's only in the summer, and that's when you're really collecting data, then you got to put that in your instrument description. If it's a pre-post test kind of a scenario, you have to talk about and think about when are we collecting that data, and what are you going to do if there's any stragglers that come on board after the initial pretest? So you do have to think about, based on what you say you want to measure, what tool are you going to use? And, you know, I would suggest right now, like, this is a really good time to revisit this, because like there's probably gonna be some issues with data collection. Well, there is for this year because of COVID, likely for many of you, and there could be in the future. So let's just to double check yourself, are we really collecting data in the best possible way? Like if every single year you've been relying on data from a school district and it's always a headache and it almost never happens the way you want, it may be a good time to think about, all right, given what our members are doing, is there something else we could use as a tool that some other form you could use. Maybe it's easier, shorter. I think I froze. I got the, you are unstable. I'm like, uh-oh. So hopefully I'm back. So anyway, it's, are you really using the right tool and the right way to get, like, I think a lot of times people think pre-post surveys, observation checklists are fine for certain kinds of things. Sometimes it might be interviews, focus groups, and there's different ways to do that these days. But think about, okay, what's the best way to collect the data for your program situation? You also have to think about who's in the know. Like, if it's like a standardized test, then it's like teachers maybe and schools or school districts are who you're going to get the data from. But if teachers are never filling out forms, maybe there's something that AmeriCorps members could fill out about the students. If you have a tool and members have been taught how to use it, maybe that's something you can control. If teachers are never doing it and you don't feel like you have good data, maybe it's time to rethink what you're going to propose in your grant application about how you're going to get the data. Like who you need it on and who's gonna fill it out. Like that's kind of two sides of the same sort of thing. And then rethinking when you collect data. So the only thing I would mention here, and you know, hopefully the COVID thing is gonna be gone by the time this next program round would start, but if there are some, like maybe in the past, it's been a pre-post kind of a thing, especially for education programs. But, you know, it might be useful to also get a midterm data point. Then if something happens between like January and the end of the year, it's not like you have no data. Like if you're only relying on pre-post tests, if there's any screw up, like you have nothing to report. Like some of you may have very little to report for last year if you were using a pre-post test. You know, it's just kind of the way it is. And right now there's flexibility to that, but I just want to like offer the food for thought. Is there any small adjustment in how you're thinking about your timing of data collection that you could think about moving forward that would help you make sure that you have some data? Yeah, so I think like thinking ahead, especially if, you know, you've always said, all right, members do activity A, we're going for outcome B, this is how we've always done it, it's a straight line. You know, maybe this is an opportunity to like just revisit, are we getting data in the best possible way? Because you got to write that up in your grant application. And maybe what you're already doing is getting you what you need. You feel like it's high quality. It's helping you have the snapshot of your program. But if you're not quite satisfied with it, this is a time to revisit that and make some upgrades. So now I want to walk through like the eGrants format and give some tips on each section based on, like I look at lots and lots of applications from across the country over a lot of years. And I think there's some common areas that applications can be strengthened moving forward that I want to share with you. And Emily and Andrea, you know, you see a ton of applications as well, and you know what you're looking for. So also, as we go through each of these, please jump in. So really, there's 4 big chunks in the eGrants performance measurement section. problem statement, describing the intervention. I mean, there's some other stuff that you have to pick, but the big chunks are problem statement, describe interventions, output, and outcome. And then within output and outcome, as you know, you have to give the target, you have to give a number, like in the output section, and then that, are you talking individuals? Are you talking miles of trail? And for a lot of those things, there's then, based on what output, if you pick a national measure, there's drop menus that you pick from. Then there's the measured by, and you have to say the type of tool. Described instrument. So here's my personal thought. eGrants, when they first set it up, they picked these headers. It's very hard now that the system has been being used to change what any of these headers are. So described instrument, I think actually means more than what it sounds like it does. Like you have to, for output, put in there, what's the name of the tool you're using? And sometimes it's, a program has like a digital electronic way that they're tracking member service. So you need to talk about like, what's the name of that? And if it doesn't have a name, come up with a name. But then you also, in this section, in the performance measures, should talk about what's the data collection process. Like who's the one collecting the data, when are they doing that? And then now the expectation, because there's been such a big push from headquarters on this, is, you know, put a sentence in there to clearly state how you ensure there's no double counting. Even if you think it's painfully obvious, say, okay, we double check the spreadsheet to make sure no student is listed twice, or every student has a unique ID. And so we go in and make sure there's no duplicate IDs showing. You know, it seems like it's belaboring it, but, you know, just cut off, like, be proactive. Put it in there clearly how you make sure, and you got to make sure that you have a process to do it. Presumably most of you do. But then, you know, if you got a site visit and somebody asks, well, how do you make sure, okay, you reported this output, show us how you know your members served that many people, and how did you check that there's no double counting? You need to have something to do. So it's better to do it on the front end. And, you know, there's a program that's been around for a while. They finally figured out when they were reporting how many people their members served that quarter. But they had this huge number because they were double counting. So you do need to have a system for that. And in your performance measurement output describe instrument section, you need to actually say how you're going to do that. And it's the same kind of a thing for the described instrument section for the outcome. Like, what is the name of the tool you're going to use to track or measure outcomes? And is it a pre-post survey? Is it an observation checklist? But you also need to say something about what does the instrument measure. Don't just give a title, because anybody reading that doesn't really understand what that means. And, you know, how many questions is it? And then if there's 10 questions, how many does a person have to get right to be considered a success? 1 question out of 10 right is probably not enough. But so like when you've got this big stack of surveys, say, like, how do you know which ones met your target of the amount of change you wanted to see? So you have to be very clear. How many people are gonna improve on how many things? So that, and you know, sometimes it's hard. If it's, you said they have to improve on like 5 out of 10 and they clock in at 4, you got to put them in the no category when you're doing your report. So, but you got to think about some of this on the front end. And again, you have to talk about what is the data collection process? How is this tool used? Who collects the data? Probably for most of you, it's members doing it, and you need to say sort of roughly when. And that piece I was talking about before are, okay, of everybody served, who are the ones you're focusing on for the outcomes? Like, what was the dosage they need to have met to be, quote, eligible to be included in your outcome measurement? And you got to be clear about that. So a couple of other bars. One is about the problem statement. And this, you got this as a handout as well, but I want to point out a few things. I don't expect you to be able to read this or to read this right now. But what I want to point out here is, like, one of the common issues is that people don't put enough information in either the problem statement or the intervention description so that somebody reading it understands the context that your program is. Like, if you don't put in enough information, people can't understand, here's the issue we're taking on and here's how we're doing it. So when they look at your performance measures, it's like, it's hard to tell, are they measuring the right things? Are they doing it in a good way? Because the context is unclear. So sometimes I get hired to, and a state commission will just send me the performance measures. Like, okay, check these out. Well, if there's not enough information here, I have no way of knowing if what they're proposing to measure makes sense and if their target makes sense. That's more related to the intervention description. But like, what I want you to just see kind of in the big picture, this program, this is roughly how much they distilled down from their need narrative in their theory of change to put in the grant application. So there's quite a lot of detail in here, and they actually, you know, gave some stats and did the citations just like you would do in the narrative. Not that you have to put everything from your need narrative in here. And again, you're thinking about, like, if you've got multiple buckets that your program does, in the need narrative, you need to talk about the need for both of those. But if your performance measure is only on one of those buckets, you're only doing a summary of the need for that bucket in your performance measure write-up.
Sue, can I ask a question? You've said you've reviewed a lot of proposals. I haven't had the advantage of doing that. It seems like, though, from that perspective, a reviewer has probably read a number of different proposals. And is that part of it too? Like, if you're a reviewer that's read a bunch of proposals and you're reading the performance measure section, and the proposal may have included a bunch of this detail in the theory of change section and gone into a bunch of it, but if you don't describe it here, they're not necessarily, because they've been reading so many proposals, they're not necessarily going to remember what was in that section. So it sort of feels incomplete, though it may as a whole document be there. Like,
right.
The section's kind of got to stand alone for scoring purposes.
And for ease in reading, like, what you can't assume. So what you can assume is that Emily and Andrea are going to go through your proposals with fine-tooth comb. You know, they're going to do that. And outside reviewers, you want to make it as easy as possible for them. Like, they're not going to go hunt and peck. Well, I think they said that in their logic model or what. Like, they're not going to look around. So I think you're absolutely right. Spoon feed it as clearly as possible. wherever it needs to be. Don't put the burden on whoever's reading it to have to go search and have them connect the dots. You have to connect the dots for them. And the clearer you can be every place this stuff needs to show up, it goes towards, in some ways it's, even if it doesn't come with like a certain number of points, it comes with a subtle impression management. Like if you look like you're all over the board, that's gonna throw up like maybe even some unconscious red flag. Does this program really know what the heck it's up to? But if it's like, wow, this is really consistent all the way through, people make subtle judgments about, oh, they know what they're talking about. Even if there's not any points per se. So, you know, I'm all for make it as clear and consistent all the way through as possible and take the burden off whoever's reading it. Yeah, and I don't think you, like, here's a couple of other, from other states, things that I pulled out. Like this is the full-on problem statement. Native plants and animals at risk of depletion due to invasive species. Well, of course that's true, but that doesn't really give enough information to understand. Like reading this, could you even guess what state it is? No. Or because invasive species in New Hampshire versus Colorado versus Hawaii versus wherever else, it's a different ball of wax. So what members are doing might be different, and what can happen because of it may be different also. So like that's not enough. The next one you can tell is New York State because it says it, and I forgot to white that out. But again, that heroin and opioid addiction is a public health crisis. Yeah, that's sort of in the no shit Sherlock category. But then like, but how big is the problem, and why in the area where this program has members serving? Like that's not enough. And that individuals in rural areas have less access. Okay, fine, but give us a little more. You know, presumably in their theory of change, they had more. But here it's just like it's wham bam, like you'd have to like go back and really reread what did they say they were doing and what's the real issue. So that's not enough. So somewhere between this and oops, I went the wrong direction. And this is where, like, if you can't do something quite as intensive as this, something closer to this than these would be how I would, where I would say to shoot.
I'd also point out that opioid is spelled wrong here, so which is another thing that we found in past applications. It does not help your case if there are a lot of spelling errors or typos in there.
Especially AmeriCorps. I mean, you know, like you all have been around and have presumably, like, you know how to spell AmeriCorps, and presumably you have spell checked your stuff. But I can't tell you like how many brand new applicants I see their grant applications and they don't spell AmeriCorps, like little c, no s, you know? I'm like, oh my God, you're just like fishing for dough, you know? It's like, and like, okay, if you're going in for opioid money, like make sure you spell it right. Yeah. Okay, so here's an intervention sample. This is from a Food Corps program, and they were the last one and this one, and they gave me permission to share this in trainings. So what you can see sort of in general, you know, they may have some stuff in here that's not quite necessary, like around their 720, like the targets. But what you can see from this is they're talking about what are members doing, like that it's a series of class towards the bottom, at least 10 hours, which is the number in research, blah, 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 blah. Members are going to conduct this education with groups of students, 10 to 30 participants. So there's some detail in here that shows you that this nutrition education and garden enhanced program is pretty intensive. So because once I like have a sense of, okay, what are members really doing? Then when one looks at what they're saying, their output and outcome, especially outcome, and also if you know that's 10 to 30 per member, and you know how many members they have, because that would have been at the top. I didn't cut and paste that piece off. Then you have some sense of, all right, does that number for the output makes this target number for the output make sense? And with this level of what they said kids were going to get, does what they say is going to change make sense? And I gave you their full performance measurement sample just because I think if you shoot towards something more of that length with that kind of detail, you'll be doing well. And, you know, any of these things, there's always a buff and shine you can do. And it's easier to see with a program that's not yours, like, well, they screwed that section up. Like, there's always ways to improve this. So I also think look at your own stuff because there's always ways to improve it. So again, what I want to highlight is that's kind of how much they gave about the intervention. And oops, what? I lost my intervention samples. Anyway, sorry about that. But you know, some people, I must not have saved it after I substituted these out. Sorry. But what you would see is that some programs put like 3 sentences and they don't tell you anything about how much interaction they have with people, or so then it's really hard to know what is the intervention and does it lead to outputs and outcomes. So here's a sample output. They picked number of individuals served, individuals, it's a tracking system, but then they actually describe, you know, secure Dropbox site, the school partners submit the list of students selected for tutoring based on eligibility criteria. And then each person gets a unique ID and they're listed in the student database. Who maintains the roster? They add or delete as needed to ensure non-duplication, which is what I was talking about before, and accurate accounting of students and tutoring time. The tutoring time, you know, that's, it shows that they're tracking more, but the piece that really matters is how they're counting people. So that's another thing to look at is, you know, yeah. Don't put a bunch of other things in there other than how you're tracking people, because that then confuses, do you know what you're actually counting? Like that your system may track a bunch of other things. I think saying that, like, if it's based on program eligibility criteria, then, you know, you put that in, but don't put a whole lot of other stuff that a tool measures other than number of individuals served. And it's like never a survey unless you're actually counting pieces of paper. It's got to be some other thing. It's usually a tracking system, a log, attendance roster, something like that. So here's a couple that, you know, are not very strong because it's, yeah, case management system, but then they're talking about cases closed, how many in client families. Okay, maybe that's helping get to the target, but results, as soon as you start talking about results, that's not an output. And member hours spent, all programs have to do that. That doesn't need to be like, you don't need to talk about how you're tracking member hours when you're actually should be talking about how you're counting veteran family members. And that just counting organizations will be counted. Like, that doesn't give enough information. All right, we're running down on time here. So again, it's the same thing. And I suggest you look at the samples that I sent. And like, so that you can see their described instrument thing is way more robust than what a lot of people usually put in there. So make sure that you go, like you can see here, a series of 16 questions, blah, blah. And then they talk about like who they're measuring it on. So it gives a lot of detail, really similar to what you'd put in a data collection plan. Now, just a couple of really quick things. One of the things to have in the back of your mind, you don't need to do it obviously for your grant application, but I wanted to mention it, and I sent you a couple samples, is you need to think about making sure that everybody's using, especially your outcome tool, in the same way. So I sent from that Food Corps program, like, what does their survey look like? And then the accompanying document they give to members about how you actually use the survey. It's really detailed. So like, you don't need to have that necessarily for your grant application, but since we're talking about how you collect outcome data, like if you don't have something similar, I suggest you look at those samples and think about how can you do that for whatever tools you are using. Yeah, so CNC, AmeriCorps headquarters prefers pre and post tests for people if you can do that. And do you have like written guidance? That's just something to keep your eyeball on. And making sure you know who you're going to measure outcomes on. We've already talked about that. And then here's a couple examples where it's not very detailed. An academic engagement survey, academic engagement survey, to go to, typo stuff that Emily was talking about. And it's going to show if the student attitude and behavior improved on what. And it's been used with other schools with reliability. Well, that's like kind of a throwaway, because a tool may be reliable in some other scenario, but maybe not with this program. So just because a tool works someplace else doesn't mean it's going to work for you. And as you can see, the other one doesn't really give enough info either about how it relates to financial knowledge, because then they're going in and talking about behaviors and confidence. So, but what they said they were going to measure is knowledge. So there's not really enough to help you understand how are they going to measure a change in knowledge. So just a couple of quick bars, because I know we're really out of time here. And if you have to hop off, I apologize. AmeriCorps is big on data quality. There's 5 chunks of that. 2 things that I just wanted to quickly highlight. One was validity, and that goes towards what we've been talking about, that there's a mismatch between the outcome that's in the performance measures and the tools and the questions on the tools, or they didn't do right pre-post testing, or maybe they didn't collect it from the right people. So that's just something when you're thinking about and writing up your, especially your outcome measurement, describe instrument section, keep some of this stuff in mind. Like here's one where they said they were gonna assess knowledge gains, but really it's a satisfaction survey. And did you learn anything? Yes, no. Well, that doesn't tell you anything like about how you can improve your program. So like this is bad, don't do this. So really looking at your tools and mapping them and making sure you may ask 10 things, but there's only 2 questions to get to the outcome. That's fine, but you need to be really clear and talk about that in your describe instrument section. It's this tool and these 2 questions go directly to helping us figure out if people met our outcome. And the consistency thing, that's why I gave you the sample of a tool and the write-up, because if people aren't collecting the data in a consistent way, then when you get it back and have to report, no matter what you had in your grant application, it's going to be maybe weaker than it should be. So, and these are the things that I said I gave you. So what, take a look, if you're going to revise your performance measures from this last round that you had to turn in, you got to revisit them for your new application. I sent you the checklist, which you probably already had from the current NOFO, but look through your stuff and see, okay, do you need to change anything? And make some changes. And if you want me to take a look and give you some feedback, email it to me, and I'm glad to do that. And sorry, we ran a couple minutes over. Any questions before we let you go? Anything, Andrea or Emily, that you want to add that I didn't emphasize, or that you want to make sure people get how New Hampshire looks at it?
No, the only thing that came to mind during this is that, and for some of the folks on here are newer, their programs might not necessarily be, but they are new to the program, is that Volunteer New Hampshire will periodically send out, as part of a desk monitoring, we'll send out like a data collection review form, performance measure review form, and just, you know, make sure that they're not, you know, duplicating when counting, you know, ask for a sample of their tool that they use, things like that. So just for the newer folks' knowledge of that, we do check in on it throughout the year.
Well, that's, you know, and I think that's an expectation of pretty much all commissions these days, but that's why all of this stuff has to like sound like it's the same thing, you know, and that you actually have a tool. You know, in the old days, people would list tools, and I'd go back when we could do site visits, and I'm like, well, show me your tool. Well, you know, we don't really have that. Like, okay, might need to change that up in your application next time. So as you're looking at your performance measures, if anything comes up, you have any questions, you know, feel free to ask anything. Anybody else?
Well, there are no questions in the chat box.
Okay. Well, everybody have a good rest of your day. And hopefully you got a few ideas of how to double check what you have used in the past and how to strengthen it for this round. So bye-bye. See you next time.
Thank you, Sue.
Thank you.
Thanks.
See you next week.
Bye.
Um,
Thank you.